Okay, we are back. I'm very happy to have on the Goldstein on Gelt show Dr. Douglas Scharre, who is a board-certified neurologist at Ohio State University. He's got a special interest in dementia-related behaviors and degenerative dementias, and he's actually come out with a very important test recently. Dr. Scharre, it's a pleasure to have you.
Thank you for having me.
So before we talk about the test and some of the effects of dementia, what I'd like to ultimately get to is how it affects people and sort of their financial issues. Could you just tell us what's the trend that we're seeing now in the United States?
Well, as you know, there was a large baby boom population some years back, and these individuals are all getting the tip getting past 65. And so Alzheimer's and dementias are much more common in the older age group, and so this is going to increase dramatically the number of patients that we see over the next 10 years that are going to develop these degenerative conditions.
Is there something in terms of percentages greater in this generation than there was in the previous generation, or is it similar?
I think it's similar in terms of numbers, percentage-wise, but the fact that there's just a lot more people that are getting to become older, and also, doctors are treating people better. They're living longer, and so since dementia is a disease of older age, we're seeing many more patients with the condition. But there's no sense that Alzheimer's is like an environmental toxin or something like that. It seems to be more than not genetic, more than anything.
It seems to come in many different forms, and some of us who've seen people with some type of Alzheimer's see it one way and we see it differently in the movies and the media. Is there a general definition? Is it also just people forgetting or being a little more careless, or are you really talking about kind of the more severe instances that we might witness?
Well, it's a very sneaky disease because what happens with most of these degenerative conditions, and Alzheimer's is just one form of that, but the most common form, and that is that there's these abnormal proteins that accumulate in your brain, and they're toxic, and they start killing nerve cells. And where they happen to start bothering the brain earliest in Alzheimer's disease is in the memory circuit. So memory is usually one of the very first symptoms people have trouble with, and then it tends to drift into some language areas, so word finding, and some visual spatial areas, so maybe you'll get turned around more easily in terms of directions.
So how can you tell the difference between just becoming perhaps a little forgetful and actually suffering from a real disorder?
So that's a great question. I mean, as we age, things happen over 60, 70, 80 years, however old we are, and to the brain, and it doesn't work as well. And so normal aging usually causes just slower processing speed. So we're slowed down maybe at figuring things out, but we still have good judgment and get to the right answer. We become a little bit more forgetful, and that could be normal aging. What's not normal is more profound memory loss, where we don't even know that we forgot. We're asking the same question, forgetting that we even just talked about it 5 minutes earlier. That would not be a normal aging process. And also, as you age normally, you don't lose your language skills. You keep your vocabulary basically to the end of life, so you don't start having a lot of trouble finding words. And if you were ever good at directions, you usually maintain your directional capabilities to the end of life. So these things are things that change if you're developing something like Alzheimer's.
Okay, so now tell us a little bit about what seems to be groundbreaking research that you've done regarding a special test that people can do to see if they're beginning to suffer from cognitive impairment.
Correct. So I'm a clinical neurologist, and so I'll see people with dementia, and it was very frustrating to me that people would come in, 3 or 4 years after they started having problems that were obvious to family members. We were just seeing them too late. And so I decided to, we need to do better, and the best way to do that would be perhaps a screening test. And the most practical screening test I could figure out was a self-administered one, so that it would not take, physicians' time or caregivers' time. The patient would just do it on their own, usually at a doctor's office, but it could be done, virtually anywhere. So we developed this self-administered screening test, and recently we published a study that looked at over 1,000 patients that we tested with this self-administered screening test, and we published on the results of the test, how good it was, and how we felt that it was fairly effective in identifying cognitive impairment at an early state.
We're talking with Dr. Douglas Scharre, who's a neurologist at the Ohio State University, OSU, and he specializes in dementia-related problems that people had. He's just started telling us a little bit about a new test to allow people to see if they themselves are perhaps at an early stage of some type of Alzheimer's or dementia. So I'd like to dive a little bit more into that, because let's say you're afraid or you have a history in the family that you think you really might suffer from this one day. If you find out early, does that somehow help you to either protect yourself or to delay the onset?
Exactly. So even if it turns out, and there's many causes of cognitive issues, and just wanted to say up front that this test is not diagnostic of any particular or specific condition. It won't tell you whether you have Alzheimer's or dementia. It just says, hey, there's maybe some problem with your thinking. But if you get some, if you do identify, perhaps with this test, cognitive issues very early, and you can start medications. The medications that we have right now for things like Alzheimer's work better the earlier you start them. And so we can help slow down the course if we can identify it early. The other big advantage as well in identifying cognitive issues early, whether it's Alzheimer's or for some other cause, is that if you know that mom or dad is struggling a little bit more, they're doing poor on this self-administered test, maybe they need a little bit more supervision. Perhaps you would maybe look over their shoulder at their finances, make sure they're not getting taken advantage of or missing payments, or check their driving, make sure they're taking their medications. People are on, get on a number of different medications for chronic medical conditions as they get older. And what happens if you start forgetting, you'll have poor compliance. You'll have worse problems with complications of your other chronic conditions. And that's would, mean more doctor visits and maybe more hospital stays if you're not taking care of your other conditions or not taking your medications appropriately. So just supervision would be tremendously helpful for the health and hopefully the quality of life for the individual.
Mm-hmm. Okay, so Doctor, you're touching on something that I really wanted to focus on a little more now, which is as a sandwich generation kind of person might begin to see his parents suffering. At what point would you say, listen, you've got to go in and take over their finances? That's sort of part A. And of course, part B of the question is, because it's so delicate, how do you recommend that people bring up the topic with their parents?
Well, I think for this, if you take a self-administered test, you could take it, I recommend everyone take it sort of as a baseline. Maybe when you're 65, perhaps you're still thinking pretty well at that time, you have a baseline so that you can take it over time, every year, every 2 years, and then you can see very early if there's a change. And it's when we see a change in cognition, when people are doing worse from their usual baseline, because everyone starts at different talent levels, that would be the time to say, hey, let's evaluate a little bit more, see what the cause of the cognitive issues are. And maybe then you'd be looking at, if you're noticing these changes, looking over their shoulder at their finances. And if they're still doing it fine, then you may just let them keep going with it. But if you're noticing some changes that they're making mistakes, that might be the point to try to help them with it. And maybe initially just over their shoulder, come over, and then maybe eventually, if they still have a lot of cognitive loss, you might have to take over everything.
Yeah, the problem that I've seen, my day job is that I'm a financial advisor. I only get to do the radio gig once a week, and I get to speak with fascinating guests like you. But when I talk to real life people about their real life money situations, I'll hear some of the strangest stories. I had a client once who came in and said that her father was losing it and not doing so well, and he used to say she would come over and try to look over his shoulder, and he would say, well, just don't go over there. He'd point to a closet in the house. And of course, the moment he went for his nap, she went and she looked in that closet, and she found over $1 million in cash that he had been accumulating. He took all of his savings out of all the banks and put it there. And, by then he was really, really, far removed from the reality of the situation.
Right.
Are there certain phrases or terms that you could suggest to someone to say, hey, Mom, hey, Dad, I think such and such, so that you can find a respectful way to let you help?
I find that and sometimes if you're a family member, it's very difficult. If you're a spouse or a child, that sometimes there are issues or they may not listen to what you have to say. And so our suggestion is with these types of self-administered tests is to get it to their physician. And sometimes the physician has a little bit, different relationship with the individual and can bring up these things easier and start talking to the patient and caregivers and family a little bit easier than maybe a family member. So if you're struggling, if they're not taking advice or suggestions from a family member, my suggestion would be to see if you can engage the physician to help out. And you can always call the physician on your own and provide information and ask them to help with these different situations.
Mm-hmm. That's an interesting approach. I also get that sometimes as in the financial advisory capacity when people, I often tell people that I'm more of a marriage counselor than a financial advisor because sometimes just helpful to have someone on the outside. So that sounds like really great advice. Dr. Scharre, we are just about out of time, but tell people, how can they find your test if they want to go ahead and do this?
Sure, you can go on the website and you just type in SAGE test, SAGETEST, that's one word, .osu.edu, and that will lead you to the test site. You can take one of the 4 forms there and take it to your doctor after you finish it.
Okay, Matt, how long does it take to do this test?
It's about 10 to 15 minutes, depending on how fast you are in terms of doing it. You print it out and just do it with a pen.
Okay, it sounds like it's a very easy thing to do. I think I'll go ahead and try it. And not only that, we will put a link to that at the show notes of goldsteinongelt.com so that all of the listeners here can get a copy. Dr. Scharre, it is fascinating work that you're doing. I really hope it helps a lot of people out, and I'd like to thank you very much for your time.
Thank you very much. Bye-bye.
You've been listening to the Goldstein on Gelt Show with money maven Doug Goldstein. Doug's weekly radio show is heard around the world, but if you miss it, you can download the podcast at www.goldsteinongelt.com. The Goldstein on Gelt Show gives you up-to-date financial ideas so you can get on the path to financial freedom. If you'd like your questions answered on the air or off, send Doug an email to doug@profile-financial.com. It's your money for your future, so join Doug every week to build your wealth on the Goldstein on Gelt Show.